Today we're getting under the hood with Dr. Andrea Braden, a board-certified OBGYN and breastfeeding medicine expert who is passionate about advancing women's health, devoting her career to enhancing the postpartum experience. As founder and CEO of Lybbie, they are at the forefront of breastfeeding innovation, empowering mothers with their wearable milk supply sensor and app. In addition to her work at Lybbie, she serves as the Medical Director at the Atlanta Birth Center, and with prior experience as the Medical Director of Emory's midwifery group from 2016 to 2021. She brings a wealth of expertise to this role. As a lead OBGYN hospitalist clinical educator at TeamHealth and a board-certified lactation consultant, Dr. Braden is committed to educating and supporting TeamHealth OBGYN hospitalist colleagues while advocating for breastfeeding mothers. When not immersed in women's health advocacy, you'll find her cherishing moments with the most loving husband and 5 wonderful children. Wow, welcome, Dr. Braden.
Thank you so much for having me. It is a pleasure.
Oh, I am so excited to be getting under the hood. It's season 4, Women's March for Mental Wellness. It's also Women's Health Month, so I'm delighted to be featuring you this month. If it's okay, let's get going.
Let's do it.
Awesome. I love this question, Andrea, because, we ask every woman it, but your entry point into what got you into women's health and as an OBGYN, everyone's is a unique experience. So can you take us on that journey?
Absolutely. So the journey really began in childhood. Honestly, I come from, it's a little bit of a stereotype, but a long line of medical people as a Filipino American. Both of my grandparents on my mom's side were physicians. My grandmother was an anesthesiologist. My grandfather was a surgeon, and they came over in a very interesting political time. Martial law had set in the Philippines, immigrated to Alabama from the Philippines in the 70s and started life there, not really expecting to stay. And then they never went back. So I grew up hanging out with my family, Filipino get-togethers with very busy doctor grandparents. And that was just kind of the norm. And all of us grandkids, grew up, at the same time eating takeout Chinese and singing karaoke. We were all going to be doctors, every single one of us. Again, a Filipino joke to go into medicine. And I was really proud as a little kid to be the one who kind of stuck with it. We have doctors in every generation, but I was the one in my generation who went all the way through. And so honestly, I'll be honest, I didn't really think a lot about it when I was younger. I just knew I was going to be a doctor and that was what I was going to be. A little bit of that people pleaser disease going along there, but never considered anything else. I knew I wanted to be a doctor, and probably the only other thing I knew I wanted to be was a mom. And my career path kind of brought the two together. More to come on that later. Flash forward to medical school. I actually brought my grandmother on my med school interview. She was like my good luck charm, and she traveled with me to my interview where I ended up going, University of South Alabama. And as far as choosing OBGYN, I kept hoping it would be something that chose me. I'll be honest. I was one of those indecisive. I don't know what I want. I like everything. I like all the people. I like everything so much. And I always tell students and residents, my choice to be an OBGYN was really kind of a non-decision. It was good for ADHD adrenaline junkies, which is 100% me. The other piece was it was so broad. I knew I liked talking to people. As you know, I'm a storyteller by nature. I knew I loved hearing people's stories throughout the generations. I loved the idea of getting to know people throughout their timeline, throughout their history, throughout having babies and going through menopause. I knew that there was the opportunity to grow within the field, that I didn't have to narrow down too much. So OBGYN is both surgical and office and delivering babies and up all night and ER type emergencies and psych. It's a little bit of everything. And I knew if I changed my mind, I could always do a fellowship and be an oncologist within women's health, or I could be a minimally invasive surgeon, or I could, be a maternal fetal medicine doctor. How I ended up in academic medicine before I left and, became a hospitalist where I am now was a bit of an accident as well. I had a baby in my 3rd year of residency, totally planned, thousands of miles away from home. And I was type A, I got into med school, I got married, I'm going to have babies. This is the year I'm going to do it. And it caught me a bit off guard. I had a baby in residency, and all of a sudden that desire to be a mother snuck up on me. I knew it was there. Obviously, I knew it was there, but I didn't realize how hard it would be to do both. And it felt like I had to choose between my two loves. My first love, which was my career, which was my entire life, as long as I can remember, I wanted to be a doctor. And then suddenly there's this baby, Annalise, and she suddenly became my everything. I tell her all the time, I don't think I knew what love was until I had you. And it really shocked me to the core, to the point that I actually walked out on my job, my fourth year of residency, because it was so difficult. Breastfeeding, pumping. I didn't even think I would struggle with these things. I didn't know what I didn't know. I didn't know these things were important to me. And I didn't know the way out. And so I walked out on my job one day with plans to just be a stay-at-home mom and throw the whole career in medicine away. And then I had some great mentors. I had people who were like, don't quit. We'll hire you. You're a great teacher. You don't know it, but there's this whole field of academic medicine and you'll be perfect. Stay on and teach. So the story of how I got into breastfeeding was really, I was a brand new mom with my first new job. And they said, well, it's great that you joined the faculty, but you got to teach something. And I said, I don't know what to teach. I'm just obsessed with my baby. And somebody goes, breastfeeding. I was like, oh, I could talk about that all day long because as an OBGYN, we weren't taught anything about breastfeeding or postpartum care, nothing. Like we just kind of, you dropped everybody, we were pregnancy doctors. And it became my career path to teach America's doctors how to take care of pregnant and postpartum women and how to take care of breastfeeding women. And I became a mentor to my residents as well. So got my IBCLC, I became, the crunchy OBGYN because I cared about the experience and really learned how much that meant to me when I didn't know that before.
So it was like you knew you were going to become a doctor. And it seems like you're very passionate. So, you went on this journey, you mirrored sort of some of your family legacy, if you will. Have you been as passionate about it? Have you felt like full ownership of it versus having it be something that, it's what the family does?
Yeah. Oh man, I had kind of a wake-up call after having a baby, and I started to wonder, would I have done this if it wasn't the default that I just thought I had to do this? Now, important piece of, the family legacy is that my grandmother in the family was also an opera singer. She had like a TV show in the Philippines and she performed while she was an anesthesiologist, and she had 6 children. As my therapist would say, does that sound familiar? Yeah. I was determined not only to be a doctor, but to be a singer and to have 1,000 children and to do it all because I saw my grandmother do it. The way that I have done medicine is quite different from how a lot of people in OBGYN have done medicine. And that's what has made it my unique path. And I do feel like I have ownership of it, but it's because I stopped letting myself be defined by the rules that I thought went with the game. Let me tell you, there were a lot of rules and I was the ultimate rule follower. That's how I got so far. It took a long time building up that courage to be like, you know what, this is not a fit. And to grieve that loss of identity that I had taken on, to really find my true self underneath.
So you mentioned, so you went off to school, you had that experience, you came out, you had that scare in fourth year of residency where you almost quit and you became a teacher. So I'm really curious about that.
So I went from undiagnosed postpartum depression that was not diagnosed until my baby was 10 months old. And that was a real light bulb moment. I'm about to graduate residency. I nearly walk out and someone stops me and says, I think you have postpartum depression. And it's a bit crazy making because I'm like, wait a second, I diagnosed this. Like, how would I possibly miss this in myself? But it was such a relief, it's such a relief to realize this was not who I am. This was something that was treatable. And, this cloud that I had over me was not, it didn't define the rest of my life. So as I came out of that, like I said, I had really good mentors. I joined the faculty and they let me work per diem. So I went from 80 hours a week to 3 days a week, 9 to 5. And it was awesome. And I was a little bored, I'll be honest. I'm not Martha Stewart. I didn't decorate when I was home, and I felt like I was kind of programmed to be a doctor. So trying to go out and be social with other moms was actually pretty challenging. I felt like a nerd. I felt like I didn't have the right earrings, and everybody had these yoga pants, and I wasn't into it. Felt like I didn't know how to talk about anything when I was out with my baby. So that was the year I joined a band. I got on Craigslist, which was a thing back then, and to this day, I'm like, I could have been killed, but I answered an ad on Craigslist that was looking for a lead singer of a band. I'm like, well, I've always wanted to do that. And I went and I met friends outside of medicine. And it brought me back to who I was before doctor, wife, mom. I was me. I was a creative person, and that fueled me. I would have been happy to just perform in Steve's basement, and just be with my band friends, and we would have band drama, and I'd be so grateful. I'm like, at least I have band drama, it was great. And as far as how that affected my first year as a teacher, I did have to work a little bit to find the balance. And I think what was difficult was I was really happy that I was given the opportunity to work a schedule that a lot of people didn't have, that I didn't even know was available. And I had terrible imposter syndrome. I thought that, people didn't take me seriously because of the optics of creating a schedule that worked for me and my family meant that I wasn't as serious about being a doctor and I didn't care. And people would hold meetings and do things that were my job and they wouldn't accommodate, my schedule. And not that they necessarily should, but I mean, I remember experiences where my colleague would take interviews on my behalf or take credit, and they wouldn't even think about scheduling things when I was going to be there. And they were non-emergent, but it just felt a little passive aggressive. I saw some paperwork that had our salaries, me and my partner, and he saw it too. And he was, as infuriated as I was. But we realized as I was trying to negotiate my salary to be paid fairly, that he was being paid for the same job 100,000 more than me. And he only worked one more day a week, but I was working the same hours, just, like spread out differently. And we were both just completely flabbergasted. So I spent a lot of time trying to negotiate my salary. And they actually told me that they could only raise me up a certain percent because it was basically my fault for not negotiating the correct salary on the front end. And that was kind of really one of the things that drove me to leave that first job. It did, take a lot of trial and error to know my worth and to, and it became really a part of my career in teaching and academics. As I moved to Atlanta and went to Emory, this became a really big part of, teaching residents and young learners through the mistakes that I made, through the stories. Please don't sign anything until you have somebody else walk you through it, because you do have that imposter syndrome. You do feel automatically grateful that anybody would hire you. And, you feel greedy almost for asking to be paid what you're worth, because what are they going to think of me? They're going to think I'm asking for too much, and you don't feel worthy. And that probably comes from the way we're trained in medicine, but it took a long time to grow out of that.
Sorry that you had to experience it. It's probably happens to most women, you know?
I mean, and there was a way that there's stuff that I learned from my personal therapy that has taught me in all different aspects of my life. And I think the best thing to make me feel better about choosing myself was to realize that it's not that there's a right and wrong. My employer has these values. And I had to be really honest about my values. And at some point when things changed, the values are not aligned. And so that's kind of my saying all the time, values not aligned. It's not that I'm a bad person or you're a bad person. It's just we do get to this point where maybe I've changed and grown, or maybe the organization has changed and it's not as good of a fit as it used to be. And that's okay. But the hardest part for me has been saying no and going through a lot of breakups in the process of, if these things are not working for me, being okay with the fact that they just don't align with my values anymore. And I have a better grasp of what my values are now. And if it doesn't align with my values, then, I give myself the gift of opportunity to move on to something else.
And I think it's great because it's just a very honest, transparent, and clean conversation. So I'm curious. So you do the teaching, you find that out. I know that you're a hospitalist. What happened? Like, what was your journey like as you left that and you moved to Atlanta? I know you went to Emory. What was that like?
When I left my first job, I mean, honestly, postpartum depression. Actually, it was perinatal depression. I was pregnant at the time. Very bad winter that year. And I just wanted to be closer to home. So I'm from Alabama and I was looking for jobs. Atlanta seemed like a really good fit to come from New England area and then move down to the South and be closer to home, but not too close. And Atlanta seemed like an ideal fit. And it was interesting because I interviewed for very different jobs than what I ended up taking. And that was difficult for me. It was another exercise in saying no to what's not right for me. I've never been in private practice. I've been offered many private practice jobs, and there was just something inside that did not feel like a fit for me. And, it was so easy to get a private practice job down here, and I just didn't feel right. And I had a mentor in academics from, a national conference who I just randomly met with. And he said, here's the thing, values. Private practice is about the bottom line, making money. He's like, that's not your thing. Your favorite thing about your job is teaching, service. He's like, I mean, you could try to make it work for a little while, but ultimately you're not going to be happy because that is not what you love about your job. And you're going to get trapped in a situation where you don't want to be. So I turned the job down that I got, and I was very pregnant. And I remember I was on call one night, and I just happened to look at the Emory website, and I saw that they had an open position. So I emailed the person. They're like, we're not hiring, but send us your CV. We'll take a look. And then they called me back and they said, can you come down in a week or two? And I was like 32 weeks pregnant. I'm like, well, I can. I mean, at least it's an OBGYN practice. So if I have a baby in Atlanta, I will. Interviewed, ended up getting the job. And I felt so seen, because within 6 months of getting that job, they were like, we have this midwifery practice. You have trained in centering pregnancy. You've done all this. You're a lactation consultant. Be the director of the midwifery program. And I'm like, oh my gosh, that sounds so fun. I love holistic care and, breastfeeding and all of these things. It really aligned with what I wanted to do. So I grew in that position. As far as when I outgrew my position there, it was a culmination of things. It was COVID. I mean, I think we can all say hashtag COVID about our massive changes in the past 5 years, but that was one of them. COVID, I also went through a divorce around that time, and it was just a lot of life changes. And I wanted to be, this was really where my need to be a mother in the way I wanted to be a mother started to bubble up. I was working more and more. My call schedule was kind of taking over my life, and I was becoming really resentful about it. And I'm like, I don't want to feel resentment about taking care of patients. That's what I do this job for. And what is going on there? Why do I feel that way? And, you'd think that when the kids are little, they need you more, but it turns out as they get older, there are a lot of different needs. And I was starting to realize that my time was limited with my kids. And my husband, my new husband, he worked from home. And I found myself being a little envious that he was able to be there at the bus stop and he was able to go there if the kids were sick. And I wanted to do that too. And I was like, by golly, I'm going to find a way. Unfortunately, my previous job in Atlanta, there wasn't a type of position like that. And, I tried to see if they would create that for me and they couldn't. That wasn't what they needed. Values not aligned. And so I left and I became a hospitalist. And I have this great job where, I work 6 24-hour shifts a month, which I know sounds crazy, but it's actually awesome. And the rest of the time is my own. There's, the freedom to work on my company. And, that began at Emory. I started a company that was kind of my academic mission. As I went into the breastfeeding teaching world, I accidentally started a company, kind of a long story, but I thought it was a teaching opportunity. It turns out it was a grant funding mechanism. Right when I started at Emory, I said, somebody needs to fix this breast pump. It's terrible. The problems I'm seeing, I can't treat anybody because the tools we have are terrible. And they said, that's awesome. You're perfect. And I said, where are the students? And they said, wrong application. You applied to this grant funding mechanism. And I was like, they said, we're going to teach you how to fix this problem. And I said, okay, you don't understand. I came here looking for students and minions to fix this problem. And I'm really good at biology and teaching classes. And they're like, no, you don't need that. I'm like, well, don't I need an MBA? Don't I need an engineering degree? And they're like, no, we'll teach you everything you need to know. So to me, I was kicking and screaming like, no, somebody else, please. I kept trying to give the problem to somebody else to fix. I'm not going to do that. They were like, you don't understand. We need people like you in the industry. This knowledge that you have this clinical, both personal experience and clinical experience, the problem, you can design something amazing. And so, Lybbie was born out of that, where I thought I was just going to get some people to fix a problem for breastfeeding. And they kind of pushed me and asked me questions, had me do surveys, had me really define the problem, to the point that I got lots of grant funding later. I got patents later, and now we are creating a wearable, the world's first wearable to continuously monitor milk production in breastfeeding people. And so you wear it all day on your breast tissue, and throughout the day you can check your app and see how your milk production is going and what kind of parameters and behaviors are actually affecting your ability to produce optimally. And you can set goals and really it helps inform choices about feeding. So you don't have that guilt that is so pervasive that comes from the fear of not being able to make enough milk. Now you know either you don't need to worry because you are making enough milk, or maybe there really is an issue and you don't feel as guilty about giving, supplementation. But it's about giving choice back to the people who are suffering these issues right now. So that's where Lybbie came from.
I think that's amazing. And having had a daughter who just had a baby and understanding the journey that she had in the breastfeeding experience and the amount, because I did not breastfeed, the amount of stress and anxiety attached to the milk not coming in. Is the baby going to take to the bottle? Is she going to take back to my nipple? Like there's so many different. So if you can solve for that and give women agency in this case, or people agency to be able to breastfeed in a way that works for them, or at least understand why it's not working for them. I mean,
Right.
that's massive because I don't think, I think that breastfeeding is such an intimate thing, but when you look at, I think we had talked about the numbers. What are the numbers in terms of success? Talk a
Oh,
little
yeah.
bit.
So I'll start with the guidelines. I'll put on my doctor hat, public health hat. The CDC has done a lot of research on this, and the best health benefits for mom, baby, society really occur when the baby is fed from its mother's own milk for 6 months exclusively, which means no formula, food, other supplementation, and then for 2 years and beyond after you've added in foods and everything. And that's really aligned with the WHO, the World Health Organization guidelines, and across the world, we recommend for best health benefits for mom and baby and society. You can really see the value in helping people do this. In the United States, the last time I looked, and it may be slightly different, but about 83% of moms initiate breastfeeding. So it's not a problem of trying to get people on board. Most of my patients want to do this. Like nobody even questions it. And then once you get to that 6 month mark, where we recommend the highest benefit would be if everybody was able to do this exclusively for 6 months, it's down to 25%. Huge drops. Some people may partially be breastfeeding, but we see this giant gap from starting to 6 months. And, this has been kind of the healthy people 2020 goal, 2030 goal. It's really just trying to incrementally increase the number of people who are able to reach these milestones. And like I said, it's not because people don't want to. Something's not working. Something's not working. And it is a systemic problem. I can't solve all of them, but the part that I really see a lot in my practice, and the pain point that I would love to tackle is called PIMS. It's perceived insufficient milk supply, which is really, honestly, it's anxiety. It's food scarcity. It is the fear that drives you to do behaviors that actually could impact your milk supply. So it is a bit of a self-fulfilling prophecy. You have a fear, and it's very natural, but it is so common that I'm going to lose my milk. Some people overproduce because of this fear. Some people underproduce, but nobody's at the same starting point, and they're all kind of operating in the dark. Like, am I doing this right? Am I doing this right? Is this enough? How do I know? I'm supposed to just look at my baby and look at the diapers and feel okay. And nobody feels okay, about, because they can't, there's no like window into your breast tissue. And so what we're working on is building confident breastfeeders, confident enough to do whatever it is that is right for you and your family. But that confidence comes from knowing what is true. And we have never known what is true. What we know is how much people can pump out. So if you are somebody who uses a breast pump and then everything's coming out, which there's no such thing as everything coming out, spoiler alert, they're never empty, they're always producing, anything could affect your ability to release all of your milk at one time. So if you're judging yourself on how much milk you pump out in one session, that's actually not a very accurate measurement. And that perpetuates this fear. I can give you a story. We're a storytelling platform. So when I was a resident with my first baby, there was one time I was going from one hospital to my clinic. So, driving over lunch, literally pumping. I didn't know about pumping bras. So I have this giant, it's called Williams Obstetrics, our textbook, and put it in my lap. This is so unsafe. I probably should not be telling the story, but I put it in my lap and I put the pumps on and I balance them on my legs on my book. And, I start driving and I'm pumping. And I have to eat lunch. So I get my lunch and I'm like opening the bag over here and it's a freaking pork chop. All I have is a pork chop. So I stab it with my fork and I'm gnawing on a pork chop, pumping and driving to clinic. And then, I remember getting to the parking lot. I can't remember if it's this exact day or not. And it was just drops. It was just drops in there. And I'm devastated. I'm crying. I'm like, this is it. It's over. My breast milk, this is the best I can do. This is the only thing I can do right for my baby because I'm working 80 hours a week. I'm outsourcing everything and I can't even do this right. And I'm a freaking doctor and I can't do it right. And so that mom guilt, that messaging, the internal messaging was so strong. And, as I learn more about breastfeeding, what I know is I probably didn't have a letdown reflex. And had I just paused, gone inside, had a glass of water, and tried again in an hour, it probably would have worked. But I define myself by that failure. And, I have lived that struggle. I know that I would stay up all night long on my one night off a week. I would do power pumps to try to increase my supply. And I'd have one day off, and every 2 hours, I'd wake myself up to pump to just try to increase my milk supply. And with my second baby, I talked to a lactation consultant. I'm like, okay, here's the deal. Now I've graduated. What did I do wrong? And she's like, Andrea, of course you had low milk supply. You were exhausted. She's like, you didn't sleep at all. You just wore your body out. And then you kept trying to push more milk out. Like, you have to rest. Sometimes rest is the best thing you can do. That really made that one little nugget, man. If I could tell everybody that one, sometimes you just need a nap. Your body needs to recover, and we're so stressed. We're trying to do it all. We're trying to work and pump and like if you're not sleeping, well, it's an uphill battle. It's like being sick, it's your body's exhausted.
So talk about where you are as a company. Are you available to consumers or to mothers yet? Like what's...
Yeah, we're very close. We have our working prototype. We are actually in the process of some testing right now just to make sure that it is, really designed for equity across the board. This is something breastfeeding products over time have really just kind of been a one size fits all. And that is not really what we're looking for here. And we know that the sensor technology, there's a possibility that it might work differently with different skin tones, skin textures, or body habits, like breast sizes. So this test that we're doing right now is just to really see, are there key differences? Do we need to have people set it a certain way if they have one skin tone versus another, or if they have one cup size versus another, just to make sure that the readings are accurate. And it may or may not be the case, but we want to make sure that we're coming out of the gate thinking of all people who are making milk, because it isn't one size fits all, and we don't want to give bad information. Once we get that, it really is kind of full speed ahead. We are looking to soft launch in Q3 of this year. So we have manufacturing partners. We have funding. We were funded by Techstars last fall, which was just amazing to have that vote of confidence from a global, accelerator like Techstars, and had a lot of friends and family come on board to support us. So we have been bootstrapping most of the way. Thrilled to say that, the product has come so far along. And once we get, all the volunteer testers finished and we clean up the algorithm, then the device is pretty much already there. We've just got to, finalize the app and make sure it really, adds a lot of value, that we're giving people information that is just mind blowing. That like, wow, this opens the window to what's going on inside. And now I understand, and now I can make informed decisions about what I do.
I love the fact that you're thinking about and understanding that everyone's breasts are different. The skin tones are different, the impact of that and how it works. First, you're the first ever.
Yeah.
The first ever wearable device for this, but then addressing that as well. That will give you it'll leapfrog you into the future, because that will be, and it'll be very curious as you start testing and you go out into the world and you see these things, is really understanding how different people's bodies respond to different things, right?
Doesn't it open up a lot of questions? Because I'm just, the
Mhm.
more I dig into what research has been done about milk production in humans, there's a lot of white space, even down to what we recommend for calorie intake when you're breastfeeding. Well, it's based on how much energy it takes to digest cow's milk. So it's not even based on anything to do with human milk. We've just extrapolated how much energy it takes to digest, some milk. And it doesn't really have anything to do with the individual or what their protein needs are with this body habitus or that, So I'm so excited to look into, get a peek on the inside, see what's really going on. Like, are there illnesses? Are there other factors? This is kind of where the OBGYN background has been a real value add to our company. It's like, I know the person making the milk. I know how hard it is. I know what your body's going through. I know how different it is for somebody who has a nice unmedicated natural, midwife birth center delivery versus somebody who had preeclampsia, preterm delivery, ICU baby, way too many fluids, their kidneys crapped out on them, like trying to get both of those people to breastfeed it's just a whole different ballgame, and they can do it. but the amount of support needed, it really takes knowing much more than just right here. This is my criticism of the lactation world so far. It's so hyper focused on the breasts and the baby. Feed your baby, feed your baby. If you're not feeding your baby enough, your baby's, losing weight, then something's wrong with you and you're a bad mom. We have never really prioritized the whole person who is making the milk, and really tried to understand. And as more diseases have come about, we're really understanding, wow, hypothyroidism and diabetes can affect your milk even coming in at the right time. Are there different things we need to do to help those patients, to help those moms who maybe have a little more challenge on the front end? And again, this would give us data for research. This would give us data for the providers, for us to really understand where the challenges are, and to treat people more effectively so that they can meet their goals, whatever those goals are.
So if 83% of the women who are, or people who are breastfeeding continue on and something were to happen, like it changes the dynamics,
Oh, you talk about food scarcity.
It's like it's food scarcity both on an individual, but then on the collective level. And I couldn't help but think about that because she talked a lot about needing to produce more and more milk, and and her worries about that, and not that sense of security.
I mean, who would have thought? Who would have thought that that would be a thing? But it really was very scary. I was pregnant at the time when that happened too. And I had patients who were like, if you need milk, call me up, I'll give you some of mine. Again, it comes back to choice. A lot of people who don't have the breastfeeding experience that they wanted, they don't have longevity because of misinformation. They give formula because they feel like they had no choice. And really they didn't. They were doing the best that they could. But if you don't have the privilege of having, the financial ability to have a lactation consultant, or maybe it's COVID and there are no lactation consultants, you can't see somebody in person, you have to have everything perfectly aligned. I tell people it's like, every pregnant person is a bike rider who has to ride the bike cross country. And, assuming that everybody can do it is like assuming because you have two perfectly good legs that you can ride a bike. But you've got people who have never ridden a bike, and you've got people who are like pro bike riders. And we're like, we'll give you helmets. Everybody gets a free helmet. We're going to pay for your helmets. But without any direction, and you got to go cross country. Of course, it's not equitable. Like nobody is starting off. We are assuming that everybody is able-bodied, that everybody has all the resources, that everybody has the finances to be able to get insurance reimbursement, or that they even know how to navigate this crazy system to even get things reimbursed. It is a very heavy lift, and not for nothing, the formula companies were really smart, with their marketing. They put that stuff in your house. And so when you were 3 a.m. feeling a little crazy, you got this formula right here. It's the easiest thing to do. And, and I'm not saying that that's the wrong choice. Like that may be the right choice at the right time. The misinformation happens right there though, right? Like you get calm, but then you start to believe that that was the problem when it may have just been a growth spurt, right? And then you're like, my milk is failing. And baby clearly was starving, and I'm a terrible mom because I've been starving my baby. And then this is where people fall off the wagon. They don't know to give that signal back to their body. It is totally fine to supplement. There is a time and a place, and that is a personal choice. However, if you want to maintain your milk supply, you cannot lose that signal to your body. So you have to replace that feed with pumping or expressing somehow. You have to keep telling your body that your baby is still eating, even if they're eating from a different source. Because as soon as you stop that, your body's like, right, I can take a break. We're going to let some people go out of this operation. and it's really hard to get it back after a certain amount of time. They start downsizing.
I have a question for you, but I want to ask you this. Talk a little bit, the hospitalist role. You say you work 6 times a month for 24-hour shifts.
Mm-hmm.
So is that what is a hospitalist?
Oh, common question. Yes. So, when it first started, it's a fairly new field for OBGYN. Hospitalist medicine kind of started with the medicine field where they kind of split off. They're the office internal medicine doctors, and then they're the hospitalist ones who only work in the hospital. They don't have an office. OBGYNs started as laborists, and then they evolved to hospitalists because we do more than labor and delivery. And so the big difference between what I do now and what I used to do, which was kind of generalist, is that I don't have an office. I only work in the hospital. And every hospital is a little different, and the role for a hospitalist might be different. Some places have academic roles. where I work now, my job every day is I assist on all the C-sections. So we always have two physicians doing C-sections. So there are a lot of other private practice groups. And it's really fun because I trained a lot of these doctors. So it's almost like I'm back in academia again. I get to still train them. And so I assist on difficult deliveries, say they have twins and, they don't have backup, who's comfortable. I worked at some very high acuity hospitals. So it takes a lot to scare me. So I'm the backup, and I think a lot of hospitalists are trained in emergency care and obstetrics. Like we are the go-to, we keep it safe. We're the safety net people. We're there for emergencies. If somebody is not in the hospital because they're in their office or they're taking call from home and something comes in, which happens quite frequently, we're there. So this is why I spend the night at the hospital, because sometimes it is very time sensitive, right? Like a uterine rupture or something. If somebody's not there in time to be able to diagnose this and take that patient back for surgery, I can lickety split get somebody back to surgery if I need to, because I'm there. And so you don't have like a traffic situation to drive. It was very stressful actually for the private practice docs when these rare occasions would happen. And there was nobody in the hospital to help take care of, nobody designated to do that. So one of my primary roles in my job is to be the backup for the private practice docs. And then, there are a lot of patients who come to the hospital. Maybe they're visiting from out of town. Maybe they were never able to establish care with an OBGYN, so they don't have a doctor, but they know that they need to be seen. They know they're moms. They want to take care of themselves. And the system can be really difficult. Maybe they didn't know they were pregnant till 34 weeks and now they can't get in anywhere and they can't navigate the insurance system. So they will show up at whatever hospital has a labor and delivery, or they call the ambulance and the ambulance just takes them wherever. So these people are unassigned because they don't have a doctor at the hospital. So I will take care of any unassigned patients. Maybe they have a doctor somewhere out of the city or somewhere else. And so it's pregnancy related things. So, I'll check on them in triage and just make sure the pregnancy is okay. Or I'll see patients in the emergency room as well. So this is non-pregnant people. Sometimes it is early pregnancy, ectopics. We do a lot of ectopic pregnancies. Sometimes it's a miscarriage where they're bleeding a lot and they haven't had time to establish care. So it's kind of a lot of people before they establish prenatal care where it's really early pregnancy care and they don't have a doctor. So I'll take care of those. And then a lot of like 40-something women with fibroids and perimenopause and horrible periods who are hemorrhaging, that kind of thing. Sometimes it's sexually transmitted infections that have gotten really out of control, like tubo-ovarian abscess, people who are really sick and septic from a quick infection they didn't even know they had, and it turns into something worse. So those are probably the most common situations. Sometimes cysts on ovaries and things like that.
I'm kind of curious because you mentioned this, not kind of off the cuff, but you said that, you struggle with postpartum depression. And the reason why I bring that up isn't to take us back, but it's season 4, Women's March for Mental Wellness. And I love to ask this of our guests, how are you marching for mental wellness? And it can be on a personal level and on a professional or a combination of both.
Yeah. Oh gosh, there's so many ways to answer this one. I would say, professionally, I speak out on it, and it is difficult, but, I recently contributed to an article with the Atlanta Journal-Constitution about mental health resources. It is difficult. We have resources, but it feels very siloed. I work with ACOG on a national level, mostly on the breastfeeding expert work group, but there's so much overlap with mental health and breastfeeding difficulties. So being able to comment on a national and state level, Georgia OBGYN Society, and contribute in that way to how can we improve mental health in the postpartum period. For me, my box that I live in is the postpartum period. That's where I see a lot of the mental health issues. And so advocating and supporting when people are trying to make changes, trying to screen and make sure, I have the luxury of time since I don't have an office, when people show up in my emergency room, to be able to really sit down with them and introduce them to resources that they may otherwise not know about, because every practice is different and every patient encounter is different. And even the experience of the doctors is different. So, I speak out on my own platforms. And then, on the personal level, it again comes back to what you're doing here at Under the Sisterhood. It's the storytelling, I think, probably is where I have the biggest impact because I have lived it. And I think it really disarms people and makes them feel like it's okay to disclose things when I tell them, me too. I've been there. I mean, I was just recently diagnosed again and I had no idea. And I'm like, oh my God, I've done it again. Like, how did I miss it again? But, it really is kind of wild that disease, there's so much we don't know about postpartum depression and depression in general. And normalizing that, talking about it in my friend circles, my professional circles, and telling people my stories that, I think it's very easy to get a social media perspective of my life. And, I've even had friends who are like, oh, your life's so perfect. You have this like doula photographer for your baby and everything. And I'm like, I can't, I refuse to make that picture of my life because it's not accurate. I have struggled. I'm on an antidepressant. I have no shame about that. Man, I can't believe I waited so long for that. Like, I can't believe I waited so long for that. But it helps. Everybody needs a little something. And, I have an awesome therapist who I can't quit. And she tells me how it is. And I quote her every day. I think I refer everybody I know to her. And when I was doing a C-section the other night with one of my colleagues. And she's like, oh my gosh, who's your therapist? I send so many people to my therapist that way because I'm like, you'll love her. She's amazing. And, so I think mine's more boots on the ground, grassroots type of work with mental health. But for me, in the past, the most impactful thing has been telling them the story of my career. Every time I pitch for my company, it starts with the story of postpartum depression. And I can't tell you how many people come to me in tears after I pitch, and they're like, I'm still crying 30 years later. Even dads, husbands, partners get very emotional about it. And they're like, where were you 10 years ago? We suffered so much, and it really strikes a chord. So I think for me, tying it together on the entrepreneurial end and really kind of boosting companies that are working on maternal mental health as well has really, kind of been a huge part of my career.
I think it's really important, Andrea, as you tell these stories, it is what connects people. It is, they feel seen, they feel heard, they recognize that they're not alone in what they're experiencing. And the other thing I think that's interesting in these sales pitches that you're having with maybe My Lybbie is now that you're speaking, a lot of the investors are men, you could say, well, did your wife go through this? How did you experience? Did you go through postpartum depression? Because there's a detachment, the family dynamic changes in the relationship with the husband and wife. It's a really powerful story and it's the truth. And we know that living in this authentic space is really, really critical, especially when you're going through so many changes.
I think probably the biggest learning that we've taken away, and now that my husband is on board as our COO, he says this all the time. He's like, every time we speak about our product, a dad comes up and says, we went through this, like we don't even have to ask. It is more rare for me to have investors who are like, what? Is this really a thing? Like almost everybody's just like, oh, that's what we went through. Like we put a name to the pain. And it really connects people. So part of, our mission with Lybbie is to create that village and to make people feel less isolated and to know that, I think of it like a guiding light. When I was going through my divorce, I remember posting on some random Facebook group. I was having a really hard night and I'm in my bathroom. I can't breathe. I'm sobbing so hard, just grieving the loss. And some random woman, I don't even know what her name is now, but she said, we are here to light the way for you. We've been there and we've come out the other end. And that's what we're here for. And that phrasing really stuck with me, in that moment. But also in these other moments, I'm like, I feel like I have been through the ringer and I feel like I came out better at the end, but sometimes you got to drop through the bottom and crash through the floor to realize the potential and, how strong you are. And it took so many other people telling me their stories and being like, me too. And let me show you the way. Let me tell you about sometimes you just have to ride the wave of those emotions and be in it and be present and let it flow through your body so that you can get to the next step. Don't fight it, don't fight that. And so for me personally, it's about being that guiding light, however I can be, using my platform as an OBGYN and, having a national role with ACOG to be able to shine that light for other moms. So, maybe we can actually make a big difference in that way with people suffering.
But I think what's interesting about it is, so you're seeing it from all these angles. And so you're highly credentialed, but you're actually showing and exposing yourself as being vulnerable and human, right?
Yeah, yeah. I mean, that's the secret sauce, I think. That's what makes it enjoyable for me. You asked me at the beginning, if I felt like, this was chosen for me. And I honestly, I would have been very happy to be a hairdresser. I think I could have been a bus driver. I think I could have been happy doing a lot of things, but I found my meaning in my career through those connections, through sitting down with patients and listening to their stories and seeing them. I don't think everybody is comfortable in the storytelling realm, but I have found that that has made my career better by being, the more honest I am, the more I show up as my very human self with all of my bumps and bruises, all my beautiful parts, the more I connect with people. And, so I think it's so important to just to be human, like I'm not up here. We're the same. This is the great, leveling of the playing field. We are all going through it.
I could talk to you forever, but we're going to close out this conversation with one last question for you, which is, today this is your platform, Andrea, to give women a message of all ages, of all backgrounds, of all cultures. What do you want to leave them with?
Authenticity. We're all different. And that's what makes us great. I mean, isn't that the definition of diversity of thought and experiences? And I truly believe that if you're going to use me as an example, what made me great was being, growing up immigrant family in Alabama as the token Asian. I had this upbringing in a bubble and it was lovely. And then I went to, New England, totally different experience there, then came to Atlanta, totally different experience there. I have been open to feeling all of these different experiences and showing up as myself. And it was really hard. I mean, because I was the people pleaser. I wanted to be the one who didn't cause any problems. And I wanted to be really well liked. I realized that I was kind of sacrificing my own happiness to try to accommodate everybody else. And I think it's okay to slow down, to not know the answers, and to change your mind. And so I like to think about you do the best in this course of your life, wherever you are, with whatever information you have now. And that is that, you can change course if you get more information. So whatever it is that you're struggling with, it, whatever story your life is building, it's okay to not know the answer. And it's okay to just sit with yourself. If you need to go sit in a closet so it's quiet, I really had to quiet the noise. I had so many pressures, social media, whatever it is, so many people who I felt needed me to be something for them, and I wasn't being something for myself. And the moment I learned to say no to things that were not serving me and not helping me grow was the moment that I really kind of held on to myself and gave myself a big hug and accepted the unique person that I am, that is not the magazine Kate Moss of the 90s that I grew up, like not liking how my belly looked because I, didn't look like Kate Moss. I mean, there's a lot of undoing, and that's okay. And I think take the time to be well. And if something doesn't feel right, don't minimize that. I think as women, we kind of are trained to be like, oh, it's fine. It's no big deal. I'm fine. And I was raised that way, and to really listen to yourself and to trust your intuition, because for me, the hardest part was being okay with not being happy with everything, seeing where that road leads me.
Thank you so much, Dr. Andrea Braden, for getting under the hood with me today. If people can, how would you like them to reach out to you?
Yeah, you can always email us at Lybbie. If you're curious about the company, it's hello@Lybbie, Lybbie.com. I do have a website. It's www.andreabraden.com. And there's contact information there. So you can, contact me through that website if you want to talk to me about things other than my tech company world. Social media, at Dr. Braden on Instagram. And I'm also on LinkedIn. You can just look up Dr. Andrea Braden on LinkedIn.
Thank you so much for getting under the hood with me today.
Thank you. It was an honor. Really appreciate it.
Thanks for listening to Under the Sisterhood. If you haven't already, please give us a quick rating and review on Apple or Spotify. And make sure to follow us on Instagram, Facebook, YouTube, and LinkedIn so you can hear from more amazing women. This podcast is created and hosted by Under the Sisterhood LLC and Elizabeth Elfenbein, produced by Elizabeth Elfenbein and Matt Butler, and edited by Matt Butler. The music is by Ayla Schaefer. Her song, Rose.